way. You are an innovator and you are seen as a change maker in public service. You used to be a banker, is what we heard, and then you took office as Minister of Health, I think 3 years ago, right? And you took up a very impressive health system transformation agenda. So we are very excited to hear from you here today about your journey, what inspired you, how you see this transformation moving forward. And then we have a few questions for you. So it would be wonderful if you can share, yeah, your experience and journey. Your audience here comes from across the bank, but there are many social sector and health sector specialists. And they are, of course, all excited to hear how you made the case to invest in health, because we're trying to do that for years successfully now, and are very happy about the collaboration, of course, with you.
Thank you. So first I have to put a disclaimer. I'm a nuclear physicist by training. I spent 30 years in banking. So I run the largest bank in Indonesia, and only 3 years in healthcare sector. So my apology if somebody of you have a healthcare background, my knowledge is nothing compared to you all. I look smart because I listen for many smart people in Indonesia and just replicating what I said. So I just replicating what they told me to in front of you. So that is the first disclaimer. And so my job is managing the wealth of my clients for 30 years. And then for the last 3 years, I'm managing the health of my clients. You know, my first takeout that I would like to share with you, because you are all bankers, right? You work with Asian Development Bank, or whatever your background is, you are a banker. And I mentioned this to my friend Peter San, ex-CEO of Standard Chartered, Ajay Banga, an ex-CEO of Citibank in Asia Pacific, including my friend Piyush Gupta, still be the CEO of DBS in Singapore, which is my fierce competitor when I was in Mandiri. This is what I tell them. I have clients, when they're rich client, that we give them money. All of my rich clients, if I see the WhatsApp group when I was the CEO of the banks, they're talking about what investment, what are the multiples, what are the returns, how we make more money. But this client, when they're getting older, so that was 10 years ago. So these same client, when I met now, and we are talking, what are you discussing in your WhatsApp group? What are the best doctors? So I have this illness. How can the best cure that I can get globally? So my conclusion that I would like to share with you, the best wealth is health. So please consider to follow my career. When you reach a certain level in banking sector or managing wealth, start thinking to move to health sector and become healthy. So that is my first advice. Okay, and I was asked with no medical background. Actually, I have one more career. I finished as the CEO of the bank in 2013. And 2013, I was asked by the president. I finished in 2016, but I was asked by the president to acquire Freeport Indonesia. This is the second largest gold mine in the world, and geopolitically extremely sensitive. So then I helped the state-owned ministry as the senior advisor and merged 4 big mining companies owned by the government, all publicly listed into one. So we have enough balance sheet to borrow money. Again, the number is very similar, 4 billion US to acquire Freeport Indonesia. So I love to tell many people at the time, we use American money to buy American company, 51% of it. But that's okay, because Freeport at the time, the EBITDA every year is around 4.5 billion US. So it is a very large operations, because it's the second largest gold mine in the world. So I've been the CEO of the Indonesian mining holding company for 22 months before I moved as the health ministers. So my background is really amazing. I mean, I go to a sector that I have zero exposure before. So in December 23rd, 2020, I was asked by the president to become the health minister. And this is the first time Indonesia have a health minister who are non-doctor, So I'm very confused myself also. And I asked him, what should I do? Budi, your job is only 3 things. Because Mr. President, I'm replacing somebody else. Our term as a minister is 5 years. My term is only 3 years and 9 months because the previous minister already taken 1 year and 2 months. I said, what are my jobs? He said, just execute the vaccinations. At that time, the economists mentioned that Indonesia, when they want to vaccinate 280 million, it will take them 10 years. So it's documented in the economists. So I came and take the job where everybody globally think that Indonesia will do 10 years, to successfully vaccinate the populations. But the way we do it in 1 year and 8 months. So that is the first job. The second job, you have to control the pandemic so the economy can recover again. The third job is very amazing. Do the biggest ever reform in Indonesian healthcare sector. I said, why me? Oh, Budi, you have seen crisis, right? You have seen, yes, Mr. President, I've seen 2 crises. One, a very big one in 1998, the Asian financial crisis. And I still remember I met European bankers and he mentioned, Budi, you have nothing left on your right side of balance sheet, you have nothing right on your left side of balance sheet. It took me 30 seconds to understand, what does he say? Nothing right on the left side of your balance sheet, nothing left on the right side of the balance sheet. And then I remember at that time I went with a Chinese banker and he said, Budi, in China, crisis, there's a Chinese word for crisis, Wei Qi, 2 characters. So the first character Wei can be paired with another Chinese character, Wei Shen, which is danger. So every crisis have a danger component. But the other Chinese character Qi can have another Qi Hui, which means opportunity. So it depends on your angle. You can see crisis as a danger or some distressed asset management, like Goldman Sachs, others see it as an opportunity because you can buy very, very low the asset and sell very, very high later on, including Budi Hartono that bought BCA at that time, make tons of money because of that. So I remember that 1998 crisis, the biggest in Indonesia, and it replicated again in 2008 global financial crisis. So I've seen 2 crises hands-on as a banker. 2008 globally is bigger, but for Indonesia, it's less because we are already suffer in 1998 crisis and we recapitalize all the banks. So we are healthier. I said to the president, yes, I've seen it. Okay, so you know what the policy that we made right and what are the policies that we made wrong. So now we have the biggest ever health crisis globally. Use your experience. Because during every crisis, he mentioned, during every crisis, this is the time where Indonesia did a major reform successfully. During 1998, it's not only political reform. We did also the biggest financial reform. The central banks have been carved out from the government to become independent. The control mechanism of the banks are getting better. The capitalizations of the Indonesian banks also being improved. So during crisis, there is a window of opportunity, like the Chinese said, you reform the industry. So that's why he said, just do the biggest ever reform. So here I am. I'm not a smart people, but I know where the smartest people on earth work. One of them is a company called McKinsey. So I called them, hey, you help me. I give you money when I was the CEO of banks, many clients, many projects for the banks. Why don't you give me a pro bono basis, to make a draft of the reform, national healthcare reform. And they make me the draft. And then I come to USAID, DFAT, and other institution company. This is the draft, which is very good, made by McKinsey. And then can you fund me to pay McKinsey to make the draft a final version? So finally I get the funding. So bankers, we want to get things done with somebody else's money, right? With somebody else's money. So we get it, the final version. And the final version make one of the biggest ever reform in Indonesian healthcare sector. They need money. I have two options. Come to his boss, Ibu Sri Mulyani, ask for money, and I know what will be the answer. Or look for the money myself and talk to Ibu Sri Mulyani. Ibu Sri, I received the money already. Why don't you write it down? You know. So I choose the second path. And because I have many, many friends working in the banking sector, I can finish the deal less than 3 months. It's a $4 billion syndicated loan. I would, with a very favorable terms and interest for the Republic of Indonesia, coming from World Bank, Islamic Development Bank, Asian Development Bank, and also AIIB. And it got signed December after Ajay Banga became president. Because fortunately, Ajay Banga, like Peter said, used to be my competitor. So we know each other. And he knows that I'm a fierce competitor defending my client. He said, okay, if you are requesting the proposal, I will sign it. Because I know the way you work. So that's why when Ajay came to Indonesia, then we get it approved in 3 months. And now we are implementing this project. So I stop here and let the question and answer, because I think that is more important for you. You can ask me for anything related with healthcare sector with that disclaimer. My background is nuclear physicist and 30 years as banker. Give the floor back to you.
Thank you very much. I can hear there also a lot of bravery. So let's hear from the audience here. Any questions that you would like to ask directly? We have a collection of questions too. Raise your hand. Yes, please. And your yes, background. Yes.
Hi again, Minister. I was part of the meeting earlier and I was very inspired with all the thoughts that you shared in the team. My question is related to how did you make the key stakeholders in your reform excited? And from being excited, how did you make them committed? Any thoughts and suggestions or strategies around that? Thank you.
Now, having a banking background, we are blessed. Usually when we meet with client, we are very observant in their motive. So the critical person to approve this loan is Ibu Sri Mulyani, right? So my line to Ibu Sri Mulyani is, Ibu, our health cost per capita is 140 US, Bu. And our average life is 72 years old. Ibu, I just give you an example how it's very inefficient and unsustainable this industry is. Look at the United States. 80 years old average life. They have to spend 11,000 US dollar per capita average. So I always have a joke with Secretary of Health and Human Services, Becerra. I said, Becerra, if I were a US citizen, when I reach 75, I will move to Cuba, migrate to Cuba. Why? Because in Cuba, the average life is the same, 80 years old. So if you're American or you're Cuban, you're most likely you will die at 80 years. But the average health cost per capita is only 1,980. So 30% of how much I have spent. So I can use the rest of the money to do something for my happiness rather than paying my healthcare bill. By the way, are you really serious that the healthcare bill is paid for the health of the people? Or maybe for the insurance company or the pharmaceutical company or hospital? And we are joking. Mr. Budi, you cannot compare. It is a communist country. We are democratic country. Okay, we compare to Japan. 84 years old, higher than US. They spend only 4,800. And you can, Japan the best? No. South Korea is better than Japan. 84 years old, outcome, they only spend 3,500. Singapore is the best in ASEAN and one of the best globally. 84 years old, the same as Japan and South Korea, but they only spend 2,800. So the difference between countries that have a very efficient healthcare spending with the rest they focus their healthcare programs on primary care, not secondary care, on promotive and preventive, not curative, on to keep people healthy, not to cure sick people. When I came as health minister, 80% of my money, 80% of my time, treat the doctors, hospital, devices, medicine to cure sick people. Not to taking care of the puskesmas, pusyandu, the cadres, community workers, promotive, education, lifestyle, exercise, none. So that's why Singapore is healthier than United States. That's why Singapore is cheaper than United States. And by the way, for your background, most of you are economists, this is what I had from Michael Porter in the last 20 years. Health costs per capita in every country except India, percentage increase is bigger than GDP per capita. You understand. The doctors don't understand these economic terms. I said to the doctors, let me give you a simple concept. If we are married, my wife asking me every year to increase her budget spending 20%, while my salary is only increased 5%. That is what exactly what I'm telling you. It is unsustainable. You know, either you divorce your wife or your wife find a richer husband. Richer husband. It's unsustainable. So I said to Ibu Sri Mulyani, Ibu, this is unsustainable business model. So we have to find a sustainable model, and to do it is to focus on preventive promotive, to keep people healthy, not to cure sick people. And by the way, jokingly, you know the SDG 3 target for healthcare sector is to promote healthy life and well-being for all people and all ages, equity and epidemiologically. Yeah? There is no such a word to cure sick people. You Google it. So SDG target for health is to promote healthy life and well-being, not to cure sick people. And I have a meeting with G20, G7, APEC meeting. I check the title, Ministry of Health, Ministry of Health, Human Services. There is none say Ministry of Cure Sickness, or Ministry of Sickness. There is none. Yeah? So that's why it is very important we focus on healthy lives, promoting healthy lives and well-being. And I said to Ibu Sri Mulyani, Bu, to convince the stakeholder, yeah, the key stakeholder, finance minister, key stakeholder in every country. Bu, if we are in, I'm 60 this year. Indonesia average life is 72. I have still 12 years to go, right? Average. He is shorter. The ambassador is shorter. But you know, Malaysia is 76. I feel healthy. So if in the next 5 years, Indonesia increase our average life to Malaysia, 72 to 76, logically, the spending will increase also, right? The healthcare spending will be increased because we are older. We spend more money to buy medicine. Assuming that our healthcare system is as efficient as Malaysia, which is we are not. We are less efficient, but assuming we are as efficient as Malaysia, then average Indonesian will spend like average Malaysian, right? Which is 432, 300 US more than Indonesian. Singaporean 2,800, 2,700 US more than Indonesians. So if in the next 5 years we go like Malaysia, Ibu Sri Mulyani, that will be additional 300 US multiplied by 280 million Indonesian, which is 81 billion US dollar budget that you have to provide to BPJS to finance this cost. And Ibu, this will become more and more become political priority because everybody afraid to die rather than afraid to be poor or to eat. If you have an option, you cannot eat, but you can live for 5 days, or you can eat as much as you can, but you die tomorrow. Oh, people, we choose, we don't eat, but we live 5 days. Yeah? Everybody in the Philippines, you believe in God. I see a lot of churches here. Everybody believe in God, but if everybody asks, let's see God, you go first, not me. So that's what happened. You know, people afraid to die. So healthcare sector will be the first priority politically every human being, every voters in the country. So it will become very sensitive. So let me finish. So what I would like to say to you is 81 billion US you have to spend, or in Singapore term, if we go to Singapore, 700 billion US. So if we don't spend the money now properly, then additional burden for the next finance minister will be very, very heavy. For the politician on the other side, what I convey to them is, this is, as I mentioned, the highest priority in every voters. Because if you manage their health, it will be the highest priority. That will recognize you, they will remember you, and they will vote for you because you improve their health condition. That is the way I'm convincing them. Okay.
This links, we had one question before you arrived, and the question was how the pandemic has helped you also to make that case, because people remembered, of course, how bad it is if you're sick.
During pandemic, I've seen two financial crises. I saw one health crisis. You know the big difference for me as a professional? When you have financial crisis, one institution you come, the International Monetary Fund, and you ask about this. Yeah? When you have health crisis, you're confused. You come to WHO can give you advice. They cannot give you money. Who can give money? Oh, Peter Stan run Global Fund. Peter Stan, Budi, I can give you money. Do you need money? Actually, I'm okay with it, but I need vaccine. So can you get the money and buy me vaccine? Cannot. I can only give you money. So you cannot give you money. Oh, if it is financial crisis, I only need money and fix the balance sheet. But if health crisis, I need medicine. I need vaccine. So not only money, the money has to be translated into therapeutic, diagnostic, therapeutic, which is we don't have. So we are confused. And then I have to ask 15 global institutions to get things right. So it's bloody fragmented. It's bloody fragmented. I said, cannot be done like this. It will spend maybe 6 months for me as a health minister, try to understand what is Global Fund, what is Gavi, what is WHO, what is UNICEF, what are the different roles that they have, who are the key person in UNICEF and Gavi who I have talked to. That's ridiculous. So I said, my proposal, we need to use this crisis to reform our global health architecture. Because like during the World War II, we reform our global finance architecture. We need to reform our global health architecture. At that time, Indonesia is the president of G20. So I'm promoting this concept and ask Ibu Sri Mulyani, Ibu, we need money, but we need to link money and translate into emergency health countermeasure. So that's why it's very important that health minister and finance minister work together. So Indonesia presidency, for the first time, we have formally announced in G20, now it's replicated in G7, it's also replicated in APEC, we have joint health and finance minister task force. I become an envy for all ministers. The one that have special access to finance minister has special access to money, right? So the education minister, defense minister, all of them want to have joint task force with finance minister. You cannot. Only health ministers properly endorsed by G20 leaders meeting, G7 leaders meeting, APEC meeting to have a joint task force. Now every year, me and my successor will always have World Bank, a spring meeting and summer meeting with finance minister, access to the most powerful ministry in the world. Second, Indonesian initiative during crisis. We propose to establish a pandemic fund. It's like an emergency fund like IMF, a single body where everybody come, where they can settle everything. The concept was being structured with help with World Bank and Ministry of Finance. But when during the during the leaders meeting, Ibu Sri Mulyani asked, "This is our idea. Yeah? This is related with health. So you need to present to my fellow finance minister, including Yellen at that time, why we need to establish this fund, and why we need them to chip in money to this fund. So I remember that time in Bali, because you're all financial person, right? I start the page in front of 20 the most powerful finance ministers in the world, including the 20 very unpowerful health ministers in the world, and I'm telling to them, hey, remember in 1944, in the aftermath of World War II, global leaders sit together in Bretton Woods, United States, in the spirit of teamwork and solidarity. They established two great financial institutions, the International Monetary Fund and the World Bank, that play a very significant role in global finance architecture to recover from the economic crisis, financial crisis after the World War, and also to protect the world from future financial crisis, which is happening. So history repeats itself. In 2022, global leaders sit together again in Bali, Indonesia, in the spirit of teamwork and solidarity, and they establish a pandemic fund that will play as an important pillar in global health architecture, that will protect the world from the recovery of the pandemic, but also we wish to protect the world in the future of the next pandemic. And it depends on you, whether you want to take a side and see things happening, or you want to roll your sleeve happening and sign the agreement and sign it. So we get the pandemic fund managed by the World Bank. But I said, don't use a developing bank principle in approving the loan. It will take 6 months. I'm a commercial bank, takes 3 months. You go to IMF, you ask for a loan, they can disburse the money, billions US dollar in 1 week. So we have to use the war mode approval process, not the peace mode approval process. Sorry to offense, but to be honest, ADB is the fastest. I'm a commercial bank. I hate the development bank. They approve the law. It's so long. I have also risk management. It doesn't mean that we don't understand risk management. Why the hell your approval cycle is bloody so long? But ADB is the fastest. I have to tell you, ADB is the fastest compared to World Bank, AIB, and SDB. Sorry.
So I know we have only a few minutes left because you have to run to your next meeting, but maybe one important question for you from us is, and you're sitting here in the innovation hub of the bank, how do you change an organization like a ministry, and how do you bring innovation to an agency and to reforms?
When I was the CEO of Bank Mandiri, I hate the IT person. Why? Because they keep asking me for money. I need this billions of hundreds of millions of US dollar investment for this, 100 million investment for this, and sometimes I don't see the result according to my expectations. So I remember one day, because JP Morgan is a big correspondent banking partner of Bank Mandiri, and I met with Jamie Dimon, and he opened the discussion, Budi, how is your IT shops? Why? I hate my IT shop. Oh, same, Jamie. I hate also my IT people. Why? Because they spend so much money and I don't understand what they are doing. So what did you do? He said, Budi, now I have a private equity arms in JP Morgan. So every time I have an IT project, I give one to the IT shops in-house and one to the startup, which is managed by this private equity. You know the result, Budi? They can do 10 times cheaper, 10 times faster, and 10 times better. So then I realized that you have to get somebody else or somebody, a trigger from outside, to change the organizations and sometimes to shake them a little bit so they are open to do something new. Something new. So when I joined this bureaucracy, if Minister of Finance quality is like this, Minister of Health is almost at the bottom. Now, how we increase this one? I change the people. So I have 6 or 7 Director General reporting to me. I take 3 from inside, 4 from outside, including from Ministry of Finance. He knows, his friend. Why? Because this is one of the most modern ministry, and I pick somebody that have the ear of Ibu Sri Mulyani. So every time negotiation about budget, I have a 50% advantage compared with any other ministers. Right? I pick Ibu Sri Mulyani right-hand man. And I take 1 Director General from UNICEF. So I brought in one candidate from the private sector, international organization, become a director general responsible for primary care, because I love primary care, to keep people healthy. And take one from BPOM, the Indonesian FDA. So in Indonesia, the Indonesian FDA, Ministry of Health, always fight. Maybe the same in USA and Ministry of Foreign Affairs, always fight, because we are independent, we don't want to be overruled by you, we report direct to the president, but the budget coming from me, so it's very funny relationship. So I took one very senior person from US Indonesian FDA to become my director general. So that changed the environment, and I have a senior advisor coming from the private sector. One for the healthcare financing, the other one for healthcare technology, the other one is hospital. Hospital is very funny. I have senior advisor. He is an investor, so he put his own money in one hospital chain in Indonesia. And because he put his own money, he became the CFO of this group. Increased the group hospital from 18 to 44 in 3 years or 4 years. And then he sold his stake. And he makes a lot of money. And now he confused what he want to do. I said, why didn't you help me on pro bono basis? You don't need money, but let me reform my hospital. So he joined. I just realized that the company that he invested and exit was mentioned by your VP responsible for private sector. Oh, Budi, we don't forget, we also invest on equity basis, not loan, in Indonesian private sector company. Which one? That one. Oh, okay, I remember that. Good one. You invested in the right company. Just the timing may be slightly off because the guy sell the money, the equity already, you're still there. I don't know, I'm just joking. But it's still there. But it's a good company, you invest. You keep investing. Maybe you are the big fish, in this business, the small fish eaten by big fish eaten by the bigger fish, and then the valuation is increased. Okay?
So I think our takeaway is bring new people, new thoughts, and partner with private sector, with technical agencies, and try to outsource some of the things you're doing, right? So that's how you brought innovations into the agency. So any last questions, or we are up with time? We have to go, right? Okay, so thank you so much for sharing your insights so openly with us, and for making health the most important thing in the agenda in Indonesia.
Last one, don't forget, when you reach a certain level, remember and consider to move your career into healthcare sector. I will close with a story. One more story. Peter Sen, CEO of Standard Chartered globally, used to be my friend, fierce competitor. He now runs Global Fund. It is a 16 billion fund on malaria, tuberculosis, and HIV. He knows me, Budi, help me raise fund on the replenishment in Washington, D.C. I help him. Sitting on the stage, and Peter Sen mentioned like this: with this 16 billion, we will save 50 million people in the world from malaria, tuberculosis, and HIV. This is the first time I hear what those 16 billion will do. So then my turn. I said, me and Peter, we have been as the CEO of bank for 30 years. Easily we raise trillions of US dollar for our clients. Trillion of US dollar. So much money. But to be honest, I feel so little contribution to humanity. Here, I only raised 16 billion. I raised 4 billion in 3 months with help ADB. This is only 16 billion. So little money compared to what we usually raise. But we feel so much contribution to humanity. So please consider seriously to move career. Thank you.
Thank you very much.
Hopefully some of you will...
It's really nice. This is mostly people who work in either health sector or education or social development, and I think it's really a big inspiration that you give to people. So, and ADB is in the middle of the reorganization, and then so we learn a lot about But you talk about bringing people from outside, bringing private sector really into, you know, what they are good in doing, right? So I think it's excellent. So thank you very much also. Thank you, Susann.
Susann?
Yeah, thank
You,
you.
We'd like to walk the minister down just for a very short interview in the history gallery, which is close to the exit.
History gallery, okay.
I'll
I
lead
didn't know
the
that
way.
there's a history gallery.